So this is our
beautiful,
lovely therapy room.
I love it.
So what's going on? What brings you in today?
I haven't been to the chiropractor in a while, so I just wanted to talk to you, get some advice on what you think to like help lengthen, strengthen my back.
You were saying something about your neck bothering you?
My neck was bothering me
Okay.
last week. It's not bothering me as much today, but
Is that something that happens regularly or on and off?
Sleep.
Sleeping? You woke up with it?
Yeah.
Okay. Were you getting any headaches or anything with it?
I do get headaches often.
How often do you get headaches?
Used to be a lot more often. I would say like maybe 1 week.
Once a week is a lot.
Yeah.
So generally, I would say like 90% of the time, headaches come from your neck and upper back being tight.
Interesting.
So I don't know if you noticed when your neck was hurting, was your headaches worse at that time?
Yeah, probably.
Yeah.
I guess I'd have to pay more attention.
Yeah,
but
pay attention.
probably.
And then what is like a typical day for you? Are you sitting most of the day, standing, driving? Like what's a
Pretty
typical day?
active.
Yeah?
Yeah, either shooting or moving around a lot, walking, Pilates, doing.
Good. How often do you do Pilates?
Probably like 4 or 5 times a week.
Best. Pilates is the best. So keep it up. So with Pilates, the reason I like it, it's like yoga mixed with like a little like weight resistance.
Exactly.
And then they always preach shoulders down and in because most people do this.
Right.
So if you like hyper focus on that, the neck and upper back pains and the headaches that you're getting shouldn't happen. So let me just see what's going on here.
Yeah, I feel like posture, like I need to work on my posture.
So you're very tight in the top here.
Yeah.
So this muscle here, it gets tight and goes all the way into your neck here, and these are your areas where you get triggers your headaches.
Okay.
So we want to like feel that knot. So we want to work on that, loosen that up. That'll help with the headache. And then posture-wise, yeah. See, like if you come here. So if you look at under her scapula here, like you shouldn't be able to put your finger in here. Your back should technically be in, like pretend it's like a pencil there. Yeah. Squeeze that. And then drop this. Like that's your ideal posture.
Oh my God.
So this needs to be more active with your Pilates workouts. That's what they're preaching. They're not just preaching shoulders down. They're preaching like squeeze this in and then kind of activate your lats.
Yeah.
So once this gets more active, this will relax. Your headaches and neck pain will go away because it's not pulling anymore. And then your neck is straight. So it's supposed to have a little bit of a curvature in there. So your neck is supposed to have a C-shaped curve like this. Yeah. It's like supposed to. Okay. Yours is like straight. Yeah. It's because the muscles here and here are pulling it. Oh. So once it loosens up, you'll get your curvature back, and then the tension in your neck and headaches will go away.
Interesting.
Yeah. So this needs to be stronger. This needs to be looser. And then what happens is then you come all the way down here. Your hips are uneven, and then your glutes here get tight and hips. Yeah. Is that tight?
So tight.
Yeah. So that's how the body works. So like one thing compensates, so it goes tight, weak, tight, weak.
Yeah. Okay.
So tight, weak, tight, and then like weak actually here, and then your hips got tight.
Yeah.
So what we'll do like, I'll set you up on some stim right now. We'll loosen it up, and then we'll figure out what to do after that. So go ahead and go face down here for me, please. There you go.
Thank you.
And so electric stim EMS brings in blood and oxygen to the muscles. So what that does is loosens them up, fixes the tone. So the muscles that are tight here, it'll force it to relax. Okay. The muscles that are weak here, it'll basically work it out for you and get it strong. And by bringing blood and oxygen to the area, it makes the muscles start healing too.
Wow. Oh my God.
So do there and there. We'll do upper back here. And then we'll do the low back as well. So the low back one, hip bone is there. So we're going to put it right here. That's the QL muscle. Okay. Sorry, it's a little cold. No. And I'm going to put one on the area that we talked about. So I'm going to lift your pants up for a second.
Yeah, no problem. I know, I noticed that's really tight when I'm stretching. I can't like get that deep in the stretches.
I'll show you a good stretch for it, yeah.
Oh, great.
And then this side as well. There you go. So I'm going to turn these on. It's going to feel weird. The top one's going to make your muscles contract and lift up. Okay. If it hurts, burns, or stings at any point, tell me to stop. Okay. If you look here, you should see it rise up in a minute. Feel that? See that?
Whoa.
There it goes. Is that good?
Mm-hmm.
Okay. The low back, it won't contract, but you're just going to feel like a tingling.
Okay.
If it hurts, burns, or stings, tell me to stop. It should feel just a little uncomfortable.
Okay.
Should be right around here somewhere. Is that good?
Mm-hmm.
Okay, perfect. So I'll leave you there, and then once that's done, we'll take you to the next room.
Okay, perfect. Thank you.
Got it. All right. So if you get up for me, please. Just follow me. Go right this way. So we're going to take you to the therapy room now. So this is our
Beautiful.
lovely therapy room.
Love it.
We're going to put you right on here.
Ready?
You're going to lay on your back,
Okay.
neck on the pillow. There's a big dip there. Just fall into it. There you go. I'm going to put this under your knees.
Okay.
Perfect. I'm going to turn this on, turn it up a little bit. So this one's going to be fun.
Yeah, this is fun.
So this is going to roll up and down your back.
Okay.
So as it rolls up and down your back, it pushes you up, causes a decompression.
Oh,
So it stretches your back out, massages you, and decompresses you at the same time.
amazing.
Most people are sitting all day hunched over, cell phone, computer, laptop, whatever it is.
Right.
So this is the opposite of it. It's putting you into extension, stretching it, just kind of putting this, extension back into the spine, the opposite of what people are used to.
Wow.
So it stretches you, like really opens you up.
Yeah,
You feel it?
I love it.
There you go. So take a nice nap on that while
Okay.
it does its thing, and then I'll come grab you.
Great, thank you.
Go ahead and have a seat there for me. And then you're going to put these on like shorts. So put one foot in there, another one in there. Sit up. Perfect. I'm going to click these in.
Mm-hmm.
There it goes. Perfect. Go and lay on your back, neck on the pillow here.
Okay.
Make sure you're comfortable. So this is compression therapy.
Great.
So you said your hips and glutes were tight.
Yeah.
So this is going to puff up like a blood pressure cuff. Okay? It's going to hit everything that it's touching. So the glutes, the hip flexors, the hamstrings, thighs, whatever is tight, it hits. So we're not going to miss anything.
Cool.
Groin, areas where you can't normally massage either. So let's pull them all the way up.
Yeah.
So then it'll stretch you out, brings in blood and oxygen into the area and just kind of flushes it out. And then like just flushes and stretches, flushes and stretches.
Beautiful.
It's really good.
Like lymphatic drainage?
And lymphatic drainage
Oh,
as well.
cool.
So it's really good, and it's a deep stretch, and like imagine like someone doing like a deep massage, just them not letting go. So it feels phenomenal.
Yeah.
Now that it's inflated, now you feel the difference. Like,
Yeah.
do you feel more like your hamstrings, glutes? Where do you feel more? Everywhere?
A little bit of everything, hips, glutes, hamstrings. Yeah.
That's what I love about this. So it'll inflate, and it gets everything that it's touching. So the hamstrings, hip flexors, low back, thighs, whatever is tight, it works on it.
Yeah.
Lymphatic drainage, swelling, inflammation, it flushes out. But good for me is it also tells me like the worst area for you. So if you said, hey, my left hamstring, I feel it there the most, I'm like, oh great, that's probably where I gotta concentrate on.
Got
So it's kind of like a diagnostic tool for me as well.
Okay,
Yeah,
cool.
so that's it. So enjoy it, and then we'll take you to the next one afterwards. Got it. All right, so this is our lumbar decompression machine. So if you have a disc bulge or low back pain, this is one of the best ones you could try out. Why is this so good? First, let's explain what a disc bulge is. If you come in close, this is her laying down. A disc bulge is something like this. The red part's the disc, and it's popping or bulging out and hitting the nerve, causes weakness, pain, sharp shooting pains, discomfort, just a lot of havoc. What the table does is it decompresses, it pulls, and causes a suction to suck that disc back in. Now the extra cool thing about this machine, we're able to go lateral flex it. So if the disc is on the left, not only are we pulling it, but we're also going sideways, so it causes even more of a decompression on that side to suck that disc back in to get you better. Now let's say you don't even have a disc bulge, you just have tight low back muscles, or if you want to get taller. Well, now we're stretching you out, loosening up all those tight muscles that are causing your pain and discomfort, and fixing that as well. So disc bulge, muscle tightness, we fix it all. Especially with disc bulges, if you have like a 12 millimeter disc, 11 millimeter disc, which we've had patients have that, we've gotten all the way down to 1 or 2 millimeters. So low back pain, disc bulge, back tightness, just come try this.